come and do my evening routine with me. This is me getting my medications ready for the morning. I have quite a few medications in the morning, and rather than try and do them when I'm half asleep, I prefer to prepare them the night before so they're all ready in the syringes for when I wake up. As most of them are liquid, they all go down my peg in my tummy, and any tablets or capsules just get mixed in water and go down my peg. You'll see these are little glass ampules. These are very annoying, I'll be honest. They're my Buscopan liquid form, and they come in little glass ampules, as you can see, and then I have to snap the top off them. I probably should use something a bit more protective than my t-shirt, but I've done them for so many years now. You know, I'm a bit of a pro at them, so I'm quite used to it. But yeah, then I pour the contents into a little pot and put the contents into a syringe. Now, this one is one of my most important medications. This is my atenolol. This is for my heart. It's a beta blocker. It's quite an awkward bottle to try and open, I won't lie. I have 20 mils of this, which is 100 milligrams once in the morning. And this is for my cardiomyopathy, to try and keep my arrhythmias and ectopic beats under control and try and limit the amount of palpitations that I get in a day. Now it's time for my evening skincare routine. Now it's time for my TPN. This is quite a tricky process. It's a sterile process, so you have to be very sterile and very careful in the way that you lay all the contents out in the tray. I do this 4 nights a week. This is how I get most of my nutrition, and this is my routine of how I connect it. So to begin with, I have to get all the equipment ready in the sterile tray. So I use a sterile technique to carefully put all the bits into the tray so they're ready for me to use to safely connect my TPN. It's now time for me to spike the bag. So my TPN bag is in this backpack, as you can see. So I have to twist the end off, and I then have to spike the bag with the connection bit, and this can be quite tricky. First of all, I have to clean the site to ensure that there's no germs to prevent any infection risk. And then once I've done this, I have to spike with the end of this connection. And this can be quite tricky, especially for someone like me that doesn't have a lot of upper body strength. So it takes me a little while to do, but I get there in the end. Once this is done, I need to prepare the pump. So this is what helps propel the TPN through the giving set and into my arm. So I have to put in the details of what my infusion rate will be, how much I'm going to have, and for how long overnight. I then have to prime the line, which is where you get all the air out of the line to ensure you don't infuse any air into your body. This can take a couple of seconds. Now I'm ready to connect to my PICC line. So again, this is a sterile procedure, so I need to put my sterile gloves on. Now you can see I get the end of my line ready. I twist off the cap. I then get a sterile wipe to clean the end of my PICC line. This is very important to prevent any infection. You really do not want a PICC line infection. Then once it's clean, I flush. I give myself a 10ml flush of sterile water just to ensure there's nothing in the line, ensure it's working well, and that it's prepped, ready for the TPN to be infused. And then once this is done, I connect the end of my line to the giving set, and we're ready to infuse the TPN. This will infuse over approximately 12 hours tonight for me. And then in the morning, once it's all infused, I will disconnect my line in a sterile way. And here is my TPN bag. I hope you enjoyed it. Thank you for joining me.